autism is just like any other disease. It does not require any special approach to treat. It doesn't require any special approach. The basic principles of homeopathy are that even in a chronic disease, when the symptoms change, the medicine changes. In majority of cases, you do not continue the same drug throughout the treatment. It's a myth. Any seasoned physician will tell you that the patients during the course of treatment of a chronic disease, they require more than one medicine in most cases. Not in all cases. We do have single remedy cures, lot of single remedy cures also, but a large majority of patients do need change of remedy at some point of time, or some intercurrent remedy at some point of time. And that is true for autism also. Autistic children also need at times different remedies. There are at times when different symptoms become very prominent. For example, a child who is relatively mild, you are treating him with, say, calcarea carbonica. Then a phase comes when the child starts throwing a lot of tantrums. Child becomes very aggressive or starts hitting. You might need a different remedy at that point of time. It could be tuberculinum, it could be tarantula, it could be cinna, it could be chamomilla. Again, it depends upon the symptoms. It depends upon the symptoms. So, in autistic children, it's very common for the child to go through phases. And those phases, if they are acute, they need to be treated with a different remedy. And that's the same principle which is given in Organon also, where Hahnemann has said clearly and categorically that any acute exacerbation of a chronic disease needs to be treated like an acute disease. That means it requires a separate remedy. What this means is that the patient might need a particular remedy for his epilepsy in general, but when the convulsion is happening, it might need a different remedy. The patient might need a different remedy for a different constitutional remedy for his asthma, but when they get an acute attack of asthma, at that point of time, it might need a different remedy. So if it's an acute state that the child goes into, it needs a different remedy. And over a period of time, because the remedy is always selected on the symptom similarity or the similarity of the state, if the state changes, which actually it does gradually change, then the remedy also changes. There is nothing wrong in it.